council meeting to order. It's the 20th day of July, 2022, at exactly 6 p.m. We do have a quorum, and we will conduct business. Let the record also show that Town Clerk Kristen Gray is in attendance. And could you please stand for the pledge? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. I'd also like to recognize our billing clerk is here, and this is Jamie Newman-Weinberg. She's the one you see when you come into town hall. All right. I would like to at this time recognize some special guests. From the town, we have Jim Rogers, who is our SMO. We also have two engineering firms here. We have from Sunrise Engineering, Dave Kennington, and from Forestman Engineering, our town engineer, Ryan Welling. And then we have from the our finance board, Rand Bitter is here. And from our NRB is Rue Rock, and she's also running for town council. And then we have Carolyn Thacker, who is on the association board. Okay, the first item of business is to have a motion to reconvene from our regular scheduled work session, which was this morning, to our regular meeting, which is this evening. If I could get a motion to reconvene.
I move the Town of Star Valley Ranch reconvene the regular meeting of the Town Council.
I'll second.
It's been moved and seconded. All in favor say aye.
Aye.
Aye. Hearing none opposed, motion carries. Next item on the agenda is to adopt the agenda. However, is there anything from the consent agenda that anyone would like moved forward? Nothing? All right. Could I get a motion to adopt the regular agenda?
I move the Town of Star Valley Ranch approve the agenda as written.
Second?
I'll second.
It's been moved and seconded. All in favor say aye.
Aye.
Aye. Hearing none opposed, motion carries. Next item on the agenda is to adopt the consent agenda. We have a motion to adopt.
I move the Town of Star Valley Ranch approve the consent agenda as written.
Second?
I'll second.
Okay, it's been moved and seconded. All in favor say aye.
Aye.
Aye. Hearing none opposed, motion carries. Okay, we'll move on to the first item of business is actually the Star Valley Health EMS, and I don't believe that's here. Okay, so we'll move to prior business then, which is ordinance 2022-06. And that is, this is the third reading of that ordinance. Pull that one up, and I'll explain it really quick. So there's been no change from this at the very first reading. Sorry. All right, so this is ordinance 2026, Title 9, General Regulations, Chapter 90, Animals. And this ordinance just made some language changes to our ordinance for dogs, specifically, and farm animals. So there are no changes since the first, second, and third reading. So would anyone like to make a motion for that ordinance?
I move the Town of Star Valley Ranch approve the third reading of ordinance 2022-06, Title 9, General Regulations, Chapter 90, Animals as written.
Second?
Second.
Been moved and second. Any questions from the audience on this ordinance? If you have questions, please come up to the podium and ask those questions. No? Okay, any council?
No.
Okay, hearing none. All in favor say aye.
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 Aye. Hearing none opposed, motion carries unanimously. Next item on the agenda is Title III Administration. This is ordinance 2022-09. This is also the third reading. And
Yes. ordinance is a cleanup of our municipal court bond. We found some of them may have been a little low, we raised them. We found some that we could combine to other ordinances or to other sections within this. So this is just a cleanup. Like I said, there has been no changes between first and second reading. So with that, I move the Town of Star Valley Ranch approve the third reading of ordinance 2022-09, Title III Administration, Chapter 35, Municipal Court Bond as written.
Second?
I second it.
Okay. It's been moved and seconded. Any questions on this from the audience? It's basically the bond schedule, so if you get a citation, you can either pay the bond or you could go to court. So that's kind of what it is. So occasionally we do have to update those numbers. No questions? Council?
No.
Hearing none, all in favor say aye.
Aye.
Aye. Hearing none opposed, motion carries. Next item on the agenda is ordinance 2022-11, Title V Water Utility. Councilman Hanson, this is the second reading. Would you like to introduce that?
Sure. This is ordinance 2022-11. The explanation is that we were just updating language to reflect policy and reduce confusion, and change just added during business hours rather than putting down days and hours. So that's all this is. There's no changes from the second reading. So I move the Town of Star Valley Ranch approve the second reading of ordinance 2022-11, Title V Water Utility, Chapter 53 definitions as written.
Second.
I second.
And moved and seconded. Any questions on this from the audience? Just a clarification, this is the second reading, so there's no changes. Council? It's been moved and seconded. All in favor say aye.
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 Hearing none opposed, motion carries. Next item on the agenda is, this is the first reading of ordinance 2022-12. Councilman Henson?
Yes. In our earlier part of our town meeting this morning, we discussed this and found some issues. We had some parking regulations, general parking regulations in Chapter 72, which is dedicated for snow removal. And so it needs a little more retooling and rewrite. So I move that the Town of Star Valley Ranch postpone this until our next meeting in August, which is on the 17th.
I'll second.
And it's been moved and seconded, for postponement. All in favor say aye.
Aye.
Aye. Hearing none opposed, motion carries. So we will postpone this until the 17th of August. Next item on the agenda is under new business, is a resolution. And so we kind of explain a little bit about what's going on, and then I'll have, ask Councilman Hanson to read it. But, so we have an opportunity to apply for some ARPA funds. The state has set aside $50 million for, water and sewer. And that's money that's straight from the federal government, so the rules are made by Treasury. And anyway, and so, with a lot of discussion with the water board and with the town council, we kind of made a decision as to what we want to do. $50 million is not a lot when you've got a lot of water districts and a lot of different towns in the state. So we are going to cut the project. We originally, we have about almost $5 million worth of projects left to do to finish the water. We've already, in the past 8 years, put $15 million into it. So we're so close to getting done. But this will help us get closer. One of the big areas that people have talked about a lot with me is Vista. So, we basically decided to do Vista and a couple of cul-de-sacs that are on Vista, and we're asking for money for this. This is grant money, so we will have to put up a match, with our own money. But, I mean, this is pretty exciting, because normally when we get funding, we get a grant and a loan, and then a loan forgiveness. So, this will include a loan for a change, so it's pretty exciting. So what this resolution does is gives, permission to me to sign it for the application. So this is for the application part of it. We'll do another resolution at the next meeting that moves our money out of, we'll move it out of reserves and dedicate it to this, but this one right here is just for the grant application portion.
From the town of Star Valley Ranch, Wyoming, resolution 22-07-20-001, water improvement project 2022 grant application. A resolution for the purpose of funding the water improvement project 2022 to replace undersized and deteriorating water lines within the water system. Whereas the governing body of the town of Star Valley Ranch desires to participate in the water and sewer ARPA, better known as ARPA, grant program to assist in financing this project. And whereas the governing body of the town of Star Valley Ranch recognizes the need for the project, and whereas the water and sewer ARPA grant program required that certain criteria be met as described in the State Loan and Investment Board's rules and regulations governing the program, and to best to our knowledge, this application meets those criteria. Now therefore, be it resolved that by the governing body of the town of Star Valley Ranch that a grant application in the amount of $1,399,023.61 be submitted to the State Loan and Investment Board for consideration at a Loan and Investment Board meeting to assist in funding Water Improvement Project 2022. Be it further resolved that Kathleen Byers, Mayor, is hereby designated as the authorized representative of the town of Star Valley Ranch to act on behalf of the governing body on all matters relating to this grant application. Passed and approved this 20th day of July 2022 for the town of Star Valley Ranch. I move the town of Star Valley Ranch approve resolution 22-07-20-001 water improvement project 2022 grant application as written.
Second.
I'll second.
And moved and seconded. Any questions on this from the audience?
Does it include all of this, all of it around the corner to Davies?
So it goes to, no, because that's done, what it does is it goes from Vista West to Vista East, and then it goes up Vista East to Green Canyon, and up there. So that's a big main line. I'm looking at Chris, she's the water person, yeah. And then there's a couple of cul-de-sacs involved in this too. So, and that really has stopped the town from repaving Vista, is because there's a water line in there, and it kind of goes like this, exactly across the street. So let's get the water down, and then we'll be able to fix Vista. And that's really the big goal. That's why we pushed this one to the front, let some of the other parts of this project off. It's a big deal. So, yes, Randy.
What's the timing, submission, review, approval?
Submission is, I'm looking at our engineer, Ryan, when did we submit this?
August 12th.
August 12th is when it's due. We don't know when it'll be approved yet, or we do?
There's a special meeting, I haven't seen those.
Yeah. This one's been
But it will be fairly soon.
Yeah, I would think so. I mean, this came really quick. We haven't known about this for very long. We've known about ARPA, but Treasury hasn't given directives to the state. So we finally got that, so this is a pretty quick turnaround. We haven't known for very long about this. Normally, we plan this way out. But we were lucky because we already had the project ready to go. So, and so that way we can turn around quickly. Not all communities are that far ahead, so it's really helpful. Don't know. We'll get that. But as soon as we know, whether or not it's approved, I'll make sure that people know. Any other questions? Town council?
No.
Okay. All right, well,
Can I make a quick comment?
yes.
For the citizens of the town, you need to be aware, the town is only funding 36% of the project. That money will come from reserve funds within the water board, which will still leave us with over $700,000 in the reserves for the water.
So kind of to add to that, it just kind of gets complicated. The town received $288,000 what they call the ARPA funding, and that was for revenue loss. But you could use it for revenue loss, you could use it for water. There's different things that we could use it for. So we just had it sitting in an account, and then when this came up, I mean, it's not money we had budgeted, anything, and so the council decided, yeah, this makes perfect sense for the water funds. So almost 300,000 of the that, the rest of it coming out of the reserves. Okay, all in favor of approving this resolution?
Aye.
Aye. Hearing none opposed, motion carries. And one more thing on the agenda, and then we'll turn it over to you, Bud. So, I now have a proclamation of gratitude for Val Smith. So, Val, you get to come stand by. If I can get off the chair. Right? So, I think that, I'm not sure everyone knows it's here, but we've had quite a process getting the surveys out. Really, Nancy Ellis has been the lead on this. But Val did just hours and hours of work, data entry, really helped pull this thing together. He has a survey background, and we really appreciate it. So I just want to read this. Thank you. The Town of Star Valley Ranch, Wyoming, proclamation of gratitude, Val Smith. Whereas the Town of Star Valley Ranch wishes to acknowledge and recognize Val Smith for his outstanding and dedicated service to the town. Whereas the Town of Star Valley Ranch has benefited from Val Smith's background, knowledge, education, and experience. Whereas the Town of Star Valley Ranch is grateful for the involvement and dedication of Val Smith while working with citizen focus groups, survey development, execution, data entry, utilizing his personal software, and final presentation of the survey results. Whereas the town will continue to benefit from the focus groups and survey results which Val Smith helped develop together with our citizen volunteers and will be used to further execute the town's master plan. Whereas the town desires to formally recognize Val Smith for his many, and I'm talking many hours, that he has donated to the town. Now, therefore, the Town of Star Valley Ranch here proclaims the town's sincere and honest gratitude to Val Smith for his contributions to the Town of Star Valley Ranch. In witness whereof, we have here unto set our hands this 20th day of July, 2022.
Mayor. I didn't really do all this. There was a committee. Nancy Ellis was my boss, and this was really just a temp job. It was a pleasure to do this work for this town. Bonnie and I have lived here 4 years, and we absolutely love it. And to be able to make any kind of contribution was a privilege. Thank you.
Okay, thank you. So we kind of moved this back. On our agenda, we have the Star Valley Health EMS, and Bud Clark is here. And so if you come over here and kind of give us an update on what's going on. And I'm not sure everyone here knows about the consolidation.
I'll give you the full one.
Okay, fantastic.
I'm gonna need one. Well, thank you for having me. I'm Bud Clark. I am the EMS director for Star Valley EMS, which is part of Star Valley Health. I work, my boss is Vice President of Human Resources. His name is Trevor Merrick. I report to him, and then he reports to Dan Ordina, our CPO. And so that's kind of how things go. So now what has occurred, January 1, we basically absorbed Alpine EMS and Thane EMS. So basically they were like, here's the equipment, throw it off. That's kind of what happened. So it's kind of, what my story is be careful what you wish for. And so, what happened January 1, so we're a 6-month-old agency. All those policies, everything I had, throw it in the trash because it doesn't even look like what it looked like. So before, if you recall, there was these 2 other entities. They were basically volunteer. Over the past year prior to this merger, we were covering calls from Afton, probably 85% of the time. So when you guys call an ambulance, it was the Afton station, 20 minutes, 85 miles an hour, top speed, get down here, and then figure out where it's at in range, right? And so sometimes it was a 30-minute response, sometimes it was a little less. Not optimal, not what we want. Where we're at today. So I have 3 stations, 1 in Afton, 1 here in Thane, and 1 in Alpine. Those are staffed full-time, 24/7, 365 with a paramedic and an EMT. So you never had paramedics in Thane before, okay? We didn't have paramedics in Alpine before. So let me speak to the paramedic scope in Wyoming. It is the broadest paramedic scope in the nation. The capabilities of my paramedics are in those rigs and our treatment guidelines, which is conducted by me and Dr. Aaron Brown, who lives down here he lives in Maine. The 2 of us run the EMS, the partnership. He's my partner in crime. So we spread out those treatment guidelines and say what those medics can do, what drugs can they push, what skills do they have, so on and so forth. I have hired paramedics from Michigan, Iowa, California, North Dakota, Arizona. All brought those on full time. So right now, our staffing model is a 48-96. They're on for 2 days, and then they're off for 4. And I have 9, I should have 9 full-time paramedics and 9 full-time EMTs. I need 2 more full-time paramedics. So right now I have a couple guys that love overtime, and they're getting a lot. So they're signing up nonstop. My CEO hates it.
Yeah.
And is always discussing that, and we have a strategic planning app called Achieve It, and it's always in red and flashing. Saying overtime, 39%, overtime, 43%. I got a down payment, but we're saving money on the employee-related expenses. We don't have 2 people in plane. Anyhow, but with that, this paramedic scope, they're basically operating at the same level. The treatment guidelines mirror that of Air Idler Rescue, the aircraft that would come in here and medevac people out of here, or classic air medical. And they mirror those treatment guidelines. That's where I came from. Prior to that, I came from Arizona originally, but so those of you like Ron that gets my phone number, Arizona. You came from Classic? I came from Air Methods, but prior to that, I came from Northern Arizona Healthcare. I was the base manager in Tuba City, and prior to that, I was an Arizona State Trooper, and they prepared me for this great second career. And as I told our sheriff, who I regularly interact with, you never have to worry about me running for sheriff. I will never be that involved ever again. So I was a state trooper. They sent me to paramedic school back in '89, and I flew for Northern Arizona Healthcare. That's where I cut my teeth as a critical care medic, and flying people out of Tuba City and out of the Grand Canyon and all that. And I was flight staff down in Phoenix. But and then I came here as a director. Took over in 2020, and then I retested and became the director. I reapplied for when we merged, I got to reapply. I serve at the pleasure of our CEO, let's put it that way. So if I get Dan mad, he can fire me tomorrow, no cause necessary. But anyhow, so where we're at today now is these paramedics are operating. We have ventilators we carry on those trucks. We're carrying about 68 beds on the trucks. There are things where if you call us and you are very sick, we're not going to grab you and run out of your door. We're going to stay there and fix you. Because we do everything as far as if you have cardiac arrest, there's nothing that they're going to do in the ER, barring give you blood, because I'm not carrying it right now. Otherwise, everything we're going to do right there. And to be honest with you, at this point, we are going around doing this, pretty much the CPR training and the code training, how we run codes, because EMS is the only people that run codes when we do it in the field. And then if we don't get something called ROS, return of spontaneous circulation, then we are going to call the doc. We're going to discuss all our options, talk with the family, and then we could basically terminate care of them if that happens. So, but we don't transport people if we don't get ROS. And we're going to stay there and work that person. And I've been in houses up here for an hour and a half, hour and 45 minutes working with patients. And I pull out all the stops if that's what the family wants. If there's a DNR, we'll do something different. If there's a DNI, we'll do something different. We follow your wishes. But the rig here sits right there on Elgin Circle, just up the road on Dana. And so their route is up the Buddy String and across. And so they're close to you. And again, staff 24/7, 365, and it's way different. So we have 3 stations, and if that rig's busy, then we have an EMS supervisor on that runs all 3 stations, and he is moving assets around to get to the end. We have an automatic vehicle location that we are utilizing to see who's the closest unit, so dispatch can say, oh, you guys are closer, you guys go to that home, and assign the closest rig.
Never had to do it, but just dial 911 and we'll get your people.
Our dispatch center is Lincoln County Sheriff's Department. Mary Ann Christensen is the supervisor for the dispatch center. She and I talk regularly. Obviously, I interact with all the fire chiefs, the police chiefs, the lieutenant from the highway patrol, and the sheriff. So I have relationships with all of those because we are on teams together and we operate together. On top of that, we are also an Idaho licensed entity. We're a border state, right? So when I came here, I was like, okay, how do we go there, give them IVs, give meds to them? And they're like, oh, we got a mutual aid agreement. I'm like, nope, we're not the fire department. We need a medical license. And so Dr. Brown is licensed in Idaho. That makes our treatment guidelines valid over there. And we own 1/3 of Caribou County and 1/4 of Bonneville County is ours because we are the closest paramedics to those locations. We have snow machines. You guys maybe saw the ad in the paper where we had one of my paramedics in IUTs that rescued somebody out of Frederick Canyon. He was having a stent. So we recognized that. We got an aircraft here, putting the aircraft going directly to the cath lab. He had 98% blockage of his left anterior descendant. That is called the Widowmaker. People usually don't survive that. So again, care here, we are also an RSI community. We do rapid sequence innovation where we would come in, give you an induction agent, sedate you, paralyze you, and put a tube down your throat and hook you up to our ventilators and breathe for you. Jackson does not do that. We do. There are 4 entities in the state that are approved for RSI. We are one of them. Laramie, Cody, and over in Castle. They're the only 4 entities that are assigned to the state. So again, EMS in the state, and that's where what happened was is that there was such disparity. So basically, you had these volunteer agencies who were trying to hang on and do the best they could, and they were doing the best they could. But you had the education level for the guys that were full time doing it day in and day out, doing this, and you had the EMTs just declining because you just can't talk about some of our challenges. I heard you guys talk about ARPA. And so, what I handed out here was, our call volume over that's going on for 2020. So far, year to date, we've run 560 calls, okay, year to date. And that includes, the types of calls we have are, we have 911 calls, and there's two types. One is a billable call, where I actually transport somebody, and then we would bill that patient for the transport. The other type is non-billable 911 calls. And then that works up to a total scene call. And then we have inter-facility work, because if you're in our facility and you need to leave here, we try to take you because it helps us pay the bills, because I've got staff, and the salaries to pay of all my people. And then we also do standbys. So these events that happen now, there is a charge for some of the standbys. If it's some type of, where somebody's trying to, raise some money for, somebody that's, had a problem, or, if it's some type of benefit, then I'll donate that time. I won't charge for that. But if it's like the Melvin's Brewing Reggae Festival, I charge for that, okay? The county fair, I'm gonna have to charge for some of that. So, which is new, because that wasn't happening before. And so there's a little bit of sticker shock going on. But in relationship to the calls, on this, there were 244 billable 911 calls. There were 180 that were unbillable. So the math on that, 73%. So actually, because 50%, half of 244 would be like what, 122 or something like that. So, all those 911 calls, we get in the rig, we drive out there, we check people out, put a Band-Aid on them, do whatever, stand by for the fire department. Law enforcement calls us, we stand by there, check people out to see if they're being arrested, go to jail, or we don't bill anybody. It's public safety work. 911 is a lose business, and lose more money, and lose more. This is going on in 23 counties across our state. There's a governor's task force going on right now on EMS. I've been over to Cheyenne on numerous occasions. I've been to numerous of these task force meetings. And the problem is that EMS is not an essential service. There are no public tax dollars that come to me. Now, you could argue that the mill levy for the hospital, well, you could say, well, that's public tax dollars. The problem was that the mill levy was set up, and it was designed for the hospital. And what do we use it for? The mill levy, last year, we got $746,000. The hospital budget is $88 million. We were a nonprofit entity. We were a for-profit only to provide you better health care. That's the only reason we're for-profit at Star Valley Health. So we're trying to get a cath lab here. We're trying to have an OB doc here. We're increasing our services to the community. That's why we're for-profit. Otherwise, we're not for-profit. We're not paying shareholders money. We're North Lincoln County Hospital District, right? So with that, the mill levy has always been used for indigent care. Our clinics that don't make money and people that can't pay their bill, we take that money and we apply it to that. So that was always going on, and we've always used it for that. So when there was legislative change, and this is where legislative bodies can run amok, right? They did the most divisive thing for EMS care in this valley when they said they changed the language and said may be used for EMS. Because then these other entities back before we were one came out and said, where's our money? Well, there wasn't no more money. They didn't put any more money in it, and we've always used it for urgent care. If I got the $746,000 into my budget, that would probably make me whole compared to what I'm doing here. That's not possible. So right now, we're trying to figure out how do we continue to fund EMS into perpetuity, so when you dial 911, you have a paramedic show up. I mean, do you want a paramedic to show up? Maybe that's the question I should ask, everybody in the town meeting. Do you want a paramedic and EMT to show up? Or would you like the sheriff's department show up, chunk you in the back of your patrol car and haul butt to the hospital. Because that's an option, right? Or the fire department, they could throw you in the bed of the fire engine, and that thing doesn't go as fast, and you could haul tail to the hospital. So these are options, but their questions need to be answered. So, and it's answered unfortunately in 23 counties across the state. So all the EMS directors from the 23 counties that are out there, we've gotten together leadership summits, and we're talking to the governor's office and trying to provide some solutions. I've asked questions about, of course, people will vote for tax on others before they will vote for tax on themselves. Is that not correct? So my you can see it, and you guys can see the call volume, but it explodes during tourist season. So is there a tourist tax that we could put on and then funnel some money into EMS to try to make them survive? Because I don't want to be profitable. I just want to survive, right? I just want to pay bills, keep the equipment going, and provide good care. That's what we want to do. And so I don't know what the answer is. We're still looking for the solution. Right now, I'll tell you what the funding source is. So if anybody in here needs a knee or shoulder done, go see Sam Winford, because our ortho is funding EMS. That's our funding plan, not a good one, right? Kevin Stuckey, Sam Winford are paying for your EMS right now. So you can have a paramedic 24/7, 365 sitting in that station, on-call availability. That's what's happening.
What is your annual budget?
My annual budget is right about 2.2. Yep, so this year I whittled away, my capital budget. Last year, my capital budget was three quarters of a million. And this year I whittled my capital budget down to just under, like 420,000.
And what are you getting out of your billable on-site calls?
Well, that is a great question, and the problem is I'm part of the hospital, and so we have some. I've asked. We are having meetings right now because I don't know what my unit hourly operating cost is. I don't know what my net, because it's all lumped into the hospital, and when they collect the money and it's all in there, they don't separate it out by EMS. So I know the number of calls that I make, I know what my budgets are, and then we have and the problem is we have this law of averages because it's not actually like you run your checkbook at your home. It's because we know what we take in for the month, but those things were billed 3 or 4 months previous. And so to actually make it reconcile, because right now there is an initiative that I will have to report to CMS, Medicare and Medicaid, for a 1-year period. And net collection rates, net collection per call, unit hourly operating costs. I mean, I just dumped the whole mess on my CFO's desk, and I said, we got to figure this out, because I got to report it to Medicare and Medicaid, and we got to do it for 1 year, and then we have 6 months to report, or they're going to fine us 20% of our overall billing for CMS, not a critical access hospital. That's critical. So we're going to figure this out. But when I took over and began here, every time I look at a rock, I'll report to you. I have no problem with transparency. Our financials, we have this thing called Meditech. I call it MetaHealth.
So if you don't know what comes in to you directly,
I don't.
It's pretty hard to figure out what it tax.
It is. I do know what my overall budget is, and I do know, I did calculations myself, but that doesn't take into contractuals. So there are contractuals we have, so that therefore Blue Cross and Blue Shield, not our friends in EMS. The hospital loves the contract. I say scrap it because it's horrible. Cuts my rates in over half. So contractuals, those are problems. I can tell you that right now our collection is 98% of what we're billing. So I can tell you that. But I don't have a payer mix. I need to know that. So, what is CMS? What is private? What is, what is TRICARE? What is, I don't know the payer mix for EMS. So at this point, can't figure this out, I have the solution. And I'm gonna outsource my billing and I will not be part of the hospital. Because I know the company that'll do it, and that's what I did in Northern Arizona Healthcare when I worked for Guardian Air down there. Again, we were part of the hospital, but they did not do our billing, and all billing for the ambulances in Flagstaff and all the aircraft that covered Northern Arizona was billed through an independent biller. And quick claims bill. And they billed our stuff and they gave us the data we needed. So one of the things we're talking about right now is I'm talking about possibly merging with South Lincoln and becoming countywide. Because, let's face it, duplication of services costs more money, right? Well, Scott Myers in South Lincoln, he doesn't even have paramedics working there. He calls me to go down there and do paramedic transports, and we do. And that's extra revenue that I wouldn't be getting, and I take advantage of that. But he has training problems. I just got a training solution. So now my training solution is Intermountain Light Flight and Classic Air Medical have merged. Intermountain bought Classic Air Medical, and that's the ship that sits over on Fort Bend. They have merged. We already had a contract between our facility and Intermountain, and they have become my training arm. So I have critical care paramedic that's assigned to Classic over at Fort Bend. He is now my trainer, and he comes over twice a month and does a full Saturday on critical care classes for my paramedics. And I'm going to be able to third ride my paramedics when we slow down in the wintertime. They'll go and ride on the fixed wings to get additional critical care transport experience. So I will keep my paramedics home so that they, and my medics work in our OR. And then you might go in and get a surgery, you could have the paramedics intubating you in the OR right next to the anesthesiologist. So we keep their skills up. I've got a plan to do that. I want to be the premier EMS delivering agency in this state. And I know what Cody Health's doing, and I'm running hard against them and Banner over in Casper. I think
I have a question for you. So I guess, because you're here to talk about this, what can our citizens do, or what are you looking for from us?
At this point, I want to see what the governor's office comes up with. The one thing we as EMS directors said, it needs to be a state solution, because doing it repetitively 23 different times in 23 different counties seems ridiculous, right? Because everywhere, and we are actually better off than most. And there's some rule changes that have to happen. There is some, I'm going to be on my way to Casper, or on my way to Cheyenne a lot more, because there's some regulatory things that need to get fixed here in this state that I found when I came here from Arizona. And when I started looking into it, I am hampered in critical care billing, because we are a critical care type agency. We don't have an ICU at our hospital, but as Dr. Brown says, Aaron Brown says, oh yes we do, it's on 6 weeks. So I have to take you, if you're on a ventilator, multi-drip, and super sick, if the weather's bad, because I can't get a flight in here for days, right? So we're taking you, and so we have to be prepared for that, and we are. So we have to be able to bill for that, and right now, I can't, because the state hasn't defined critical care transport as far as EMS is concerned. So I'm working to get that fixed with the supervisor from the Office of EMS over in Cheyenne. And so we're working on some regulatory changes, but ultimately, I don't know where we're going to go. We've talked about doing a town hall after we get these task force meetings done, where we would have a town hall in the different counties, and then maybe I would do 3 of them, like do 1 in each town here, and then talk about the options. And I don't know what those are, but I think it's some type of public-private partnership. Now, I want to thank you guys for the money that you give to us, because there is a public-private partnership already going on, and they put money toward Star Valley EMS, and again, it is an amount, and I appreciate it. And so I also have an amount that I get from the community of Happy Jack over there in Idaho. We are their EMS provider, and they cut a check to us. So, and then the other part of that is that I'm cognizant that, like, at some point, if I get the next 2 paramedics, there are things that I'm doing to try to make EMS self-sustainable. And some of those things are, for example, wildland. So if I go out and do wildland, I put a paramedic and an EMT on a wildland flyer. When I do that, they pay me $120 an hour for the ambulance as it works every day. So they usually work 16-hour days. And then on top of that, they also pay for the crew that's on shift that day. Now, if that crew that's on shift, let's say it's actually their work day for the 2 of the days that they're on the file. Well, then they don't pay for those guys because they're actually on shift. They would have been on shift if they were here. But they pay for the guys that are filling the backfill back here on overtime. So literally, if I could run an ambulance for 3 months at a time on wildland fires throughout the western United States, that would cut my basically for 3 months. I would not be paying a paramedic and an EMT salary. I would also be getting about close to $90,000 a month for the ambulance. And I would be, and on top of that, I would be able to bill all the admin, the billing time, everything. We bill them admin time and everything, and they pay.
Okay.
So that would be a great way to reduce that $700,000 I think that I need. Maybe we could get it down to only $500,000. So, and then the other part of that is the transports. So I do have a relationship with South Lincoln. As we're staffed and we're capable, we go down to South Lincoln, pick up patients. I could go to Jackson. Mike Moyer up there, the EMS chief in Jackson, he's like, you can come up here, do all the transports out of here you want. He doesn't want, he's a fire department that has some paramedics working at it. That is different from the station out of a hospital, right? And he would love to, pass that in the top. And then sending a transport rig up there, I have staffing, and again, we're never going to deplete the 911 rigs that are here. So right now, we have 3 911 rigs. And what happens when we have a transport? We try to call people in, we try to backfill of any sort. And I have PRN members and part-time members that come in and help with those transports. I will not tell you that it's perfect. There are times where somebody is super sick and we have to triage. And we can't get them out by air, and we need to take them. So sometimes what happens is, and you guys are probably in the best boat, is that there's been times where we've had only 1 ambulance working in this valley because of the transports that are going on. Guess where that ambulance is? At the Bain station, because it's in the middle of the valley. So I can't, when I was in Alpine briefly there at Town Council, I couldn't say the same myself, sorry, but it is what it is. So we're not resource fat. We have limited resources, but we at no time will we know.
So you plan on coming back at some point and kind of give us an update
Yes.
as to how things are going?
Yes, I think that after we have some more meetings with the governor's office, the task force gets working a little bit. Right now, what's happened is there was a lot of ARPA monies that had to be doled out. So June 28th was the magic day apparently, because they pumped out three of these grants that I have to have submitted by July 29th.
Oh, I understand.
And so, again, I had a lot of my pre-work done, thank God, because who writes 3 grants in 30 days? It's insane. And so they were sitting on that money, and we knew it was coming, so I was prepared, because I actually knew in March that some of this money was good. And so some of this would also reduce some things. The last thing I would tell you is that we're in the process right now to change healthcare in this valley greatly. And how that's going to happen is by something called Mobile Integrated Healthcare Community Paramedicine. I'm working with the clinics. Lynn Alexander is the director of our clinics, and myself, and several other directors within the organization, that we are going to attach community paramedics to the clinics. What is this going to look like? We have two models that we want to deliver. One is that we have 1,400 chronically ill patients in our valley that fall under something called ACO, and they give a managed care amount. If we can keep them well through wellness visits in their home and not have them in our facility, then Medicare and Medicaid will actually pay us, ACO will pay us back up to 40% of the dollar value that's assigned to that patient. It's huge. So literally, if that is up and running, EMS actually would be a profitable department within the hospital, and I wouldn't worry about the money. So the other part of this that we're looking to do is urgent care. So I talked to the clinic directors. I'm like, what is your main angst every day? She's like, sick people. Because the problem is if we have wellness things going on in the clinics, and you're coming in to see your physician, and then you have people coming in like, I'm sick, and they're trying to stuff patients in between visits and get them in to see providers. We're gonna change that. You call in, you say, I'm sick, we're gonna say, stay at your house. We're gonna send you a community paramedic. That community paramedic will come to your home. We will have point of care testing. We will come in, that paramedic is a clinician. He will do a set of vitals, he will do a primary and secondary exam. We will be able to draw blood, do labs right there. We're going to carry our lab equipment with us. We will be able to do rapid COVID, rapid flu, rapid strep tests right there and give you an answer right there. We will be able to draw blood and determine if you have an infection going on. And then that community paramedic program would even allow, if, let's say that I have cases where there is a husband and wife, they are elderly, one of them has dementia and the other is the caregiver. Can't leave when the caregiver gets sick, right? That's a real problem. Sometimes just our elderly, I can't tell you the number of rides home I give to people. Because we don't have Uber. We don't have taxis. So guess who takes you home when you can't drive a car and you're elderly? We do. I get up even sometimes myself in the middle of the night and go up, take somebody home, because they're going to be discharged and they need to get home and they don't have a ride. So what we want to do is we want to keep the sick people at home, send a community paramedic, do all the testing, and then we'll go up and put telehealth. That paramedic is already creating a differential diagnosis, and then we will telehealth with the provider. So right now, Dr. Sharp has said that he wants to champion this cause, so he'll be our telehealth provider. And then I get on with Dr. Sharp and I'd introduce my patient. I'd give them the differential diagnosis. We'd come to a care plan. I might even go to the pharmacy, pick up the meds, come back, deliver them to the patient, and they stay home.
It's kind of a follow-up to the mayor's question. Is there anything the community or the towns can do to facilitate some of the things you're trying to accomplish for EMS services? Is there something we can do to help with the governor's office or the legislature or?
At this point, I don't have that answer, but I will let you know when I will be able to reach out to you when I do. Because right now, all they've done is these task force listening sessions all around the state, and now they're going to get back together, and we're going to try and come up with some solutions. But we haven't gotten back together after they went through all of the different listening sessions throughout the state. So we don't know what, because I've asked for a lot of things when I was at our listening session, and basically I didn't get any answers because it was a listening session. So they didn't say, well, maybe we could do that, or they gave no commitment. So at this point, and everybody that I'm talking about at the office of EMS, they like nothing's come out yet. So I'm waiting to get to the next meeting to determine like where are we going, what are the solutions, you know? And I've even talked about, hey, is there something we can do with the insurance companies where they have to pay a fee to have an insurance license in this state? Can there be a tack onto that? Can some of that go to EMS in each county? You know, something like that. So, and there's HERF funds, the highway users funds. I don't know what we're doing with them right now, who gets what share of them, because again, auto accidents, a lot of our volume that we don't get paid for is related to travel along the roadway and not along costs. So that's really where we're trying to focus on, where do we get monies for that, as opposed to coming in, setting up a special district within Lincoln County and then taxing you. So I don't think we're at that point yet, and that's not my solution. So, but at this point, I don't have anything that I need of you. When I get to that point, you will know. Believe me, I will be on the radio. I will be, it is my goal here. And I live in Afton. I live right across from Kodiak, right up against the hill over there. The last house on the left, as you're headed out of town going southbound, I walk Ron's house. My wife grew up in Grover, and her mom was a Kennington, so now you guys might not know all the relatives, but I could throw a rock and hit one of her relatives. So, and I feel like I just bought my death house, so I'm staying here. So this is, as I told people, that comes and takes care of it, okay? So ultimately, I want to have the best EMS system so that we are doing the community paramedicine. I mean, who wouldn't, I mean, when you feel that crap, you would put your clothes on, get in your car, or have somebody call you down, sit in the waiting room and see your doctor? You'd rather just say, yep, send that community paramedic on over, and we come in, we take your vitals, do a couple tests, talk with you, get on the telehealth. You don't even have to operate the telehealth. We'll do it for you. You see the doc, we do a little interface, we come up with a care plan, give you this, you got a number to call if you got a problem, and you can get a community paramedic back.
Is it your vision that 911 is a way to contact that service, or will there be another phone?
There will be another phone number. However, right now, I've talked with Mary Ann Christensen at the sheriff's office, and we already get calls where, because my boss is being facetious, but he's like, I get it. So next time my child has a temperature at 2 o'clock in the morning, I should not worry. I should just call 911 and have you guys come. And then you come and do some things and do some care, and then I'll sign a refusal. I won't get a bill, and you guys will go away and my kid's sick. Because that's a lot what happens right now. It happens a lot. And so we are trying to, we have to start getting smart about screening these calls, and we do have medical dispatch. So they have training, and they have a whole series of questions that they're asking. And so they're going to try and figure out, there could be calls that we wouldn't send an ambulance, but we would say, look, the community paramedic will be, 35 minutes out or 40 minutes out, because they're just feeling bad, but they really don't need a 911 rig right now, running down the road to a freeway. So yes, I think that we have to get smarter about that, because it costs a lot of money in fuel to run these, and these rigs are heavy. They're F-450s, big box on them, and it's wear and tear on the rigs. So I think that we have to get smarter about screening our calls and figuring out what type of care is, and again, that community paramedic, that's the same paramedic that would intubate you or do all these other high-level skills and this, keeping their skills up in our OR and all that. So our medics will rotate through the community paramedic program. So they're advanced providers. They really are. And so, and like I said, I've hired these medics from all over the place. My California medic, he is actually one of my supervisors now. He's a very smart guy. But he walks by me even to this day and says, was I ever really a paramedic in California? Because he says, he goes, I thought I'd come here, be a few drugs, I'll have to get up to speed. He's like, it blew my mind. He goes, there were probably over 25 drugs you guys had that I have never given and never been trained on. It's that much. So and again, Wyoming, the most expansive practice of paramedics in the United States. Yeah, and a lot of it's because, our transport times. Even if I get somebody in that line, someday we'll have an ER down there. And I'll tell you right now, we're trying to move on the 5th, 6th. That's why I went to director's meeting today. I wanted to bring you something other than EMS. So I think the 5th, the weekend of the August 5th, 6th, we're going to try and move. We're going to move on a Friday, Saturday, and I think then we're going to be open on Sunday in Alpine, and then we'll be in our new building down there. We're vacating out of the old clinic.
You move out of the clinic into the new building.
Yeah, into the new building. So I think that's August 5th, 6th. We're going to have, I think, our grand opening. The docs and the nurses and the MAs and everything have asked, give us 30 days in the building before we do a grand opening. So I think that'll end up being in September.
And am I correct that building is, it's only a small portion
It
that
is.
they are using, and as money is available, they'll continue to
It
do
will
that?
continue. We have, I think there's 14 acres there. The goal is to build an EMS station on that same grounds. So let me just mention that. And this is one of the things where I don't know where we're going with this. There is ARPA monies out there. It's about 41 million, I think, is what I saw. But it's not just for building EMS stations. It's EMS healthcare in general. But we don't have an EMS station really. They're all just garages with some heaters in them. What does an EMS station look like? That looks like a garage portion that has drains in the floor, because we don't have that in several places. And you can imagine what that turns into in the wintertime here. So, but a garage with drains in the floor to keep our ambulances and equipment in there. It has offices for the paramedics and EMTs to work. It has a training room. It has a kitchen. It has a crew room where they can relax and rest. It has a bunk room, and then it has locker rooms. So that's what an actual EMS station looks like. We don't have that. So the house on Elgin that I rent, the ambulance parks out front of it. What we're gonna do this winter, we're gonna have to put it back in the garage over there in the town of Thane, because I can't leave it sit out in sub-zero temperatures. So it'll go back in the garage, and they'll run with the response rig over there, get the ambulance and can bring it out. So in the wintertime, we will be slowed in our responses. Now, in the wintertime, they'll be over, instead of, right now, they pretty much spend their time in the quarters there on Elgin. And that ambulance stays there overnight, and when they get called in the night, they just walk out, get the rig, and drive off. But I am wanting to, right now, that my plan in the back of my head, and I've had a conversation with the mayor, is potentially to take over the fire station. Potentially. That's just a thought process. So if the Thane Fire moved out of there, we could get in there. I've had conversations with a couple of you about if you've got property and we come up with something, I have no problem with putting the station up here. We did these contracts, and I'm a little bit bound, because normally the way we determine how we place stations, and I was not involved in the contract talks, my CEO did it, but normally we determine it by call volume. Right now, I can tell you where every one of these calls came from. I can run it, and that all the 13 communities, plus about 10 special locations that we go to all the time, like Grace River, like Freedom, Idaho, like, certain extra special spots. But we actually defined where the call is, what is the location. And so I can tell you how many calls have popped in Star Valley Ranch. When I came here, our dispatch CAD software does not do that for me, but I put a system in place that we do that with a runner. And so I can tell you where my hot call volume is, and it would be my intention to place a station in that area, right? I gotta be careful with the contract, because right now, the contracts say, my CPFO asks, do we have to have 3 stations in the valley? I said, yes, right now we do. By contractual agreement, we said we would have a station in Alpine, 1 in Thane, and we have a station in Alpine.
So I can give you a little background on that. I'm thinking it was probably 7 or 8 years ago. There was a study done in the valley, and they basically said, you need to have 1 system.
Yes.
1, not 3, doing completely different things, had 3 different billings. I mean, it was pretty crazy. And I would say government runs slow, because it took that long to get it done. And it was a lot of work, and there were a lot of feelings that were hurt. And so when you talked about the contracts, what happened is Thane felt that they wanted their name still on their ambulance, and so did Alpine. We were a contractor, so we didn't really care, we just wrote checks, so, which we're still doing. And so anyway, and that's kind of how it works. So they gave equipment, and Alpine gave equipment, and we had a contract, and so we agreed to pay for 5 years, so we have a.
So I'll speak to the name thing.
Yeah. So that's what
Again,
he's talking about a contract.
what we wrote in these contracts, we wrote, actually, they want me to violate Wyoming regulations in the contract. Because you can't be ABC Ambulance Company and run around with XYZ Ambulance Company on the side of your rig. You have to put your license name on it. So I am about to pull Thane and Alpine off of those rigs. I don't care what the contract says. I'm more worried about the regulations and our licensure.
Well, I think it's confusing to the residents,
It
because they'll say, well, why did Alpine come here? Alpine did not. It started in medical.
Yeah, I had the Alpine rig running out of the same station because
Yeah.
I inherited a bunch of equipment problems, and I got the newest ambulance from Thane
Right.
over there with a gremlin in it. They're chasing wiring at Lithia Ford and trying to fix the 2017 with wiring problems.
Yeah,
So, but anyhow, we are, and honestly, everything really operationally, things are running great for us. I am very good. So, what are your questions?
I've got a hypothetical. Let's say we have seniors
and they don't use their car lot in the winter, the result is there's a large berm in front of their driveway. And that's common for all of us, but for someone like that, it could be legal. Is that correct?
Yeah, that could be a problem. I would agree. I do know that, I mean, I have guys that we wear cleats, we have some snowshoes on our rigs, we're gonna jet ski you. And we have capabilities to get you out, other than using that stretcher that's in the back of the ambulance. So we will, no problem, call the fire department, we got a bunch of volunteers. It's gonna get crazy, a bunch of board shorts and flip-flops are gonna show up, and they're gonna help us, but they come running when we call them, and we have a great relationship with them, but we'll get you out of there. And, and I even have, matter of fact, last winter, I was up here, and I still, like, after we transported the patient out, I just shoveled their driveway for them, me and another guy stayed. And because it was clear to me that they needed that, I even took my snowblower with me and went over to a patient's house and blew out their place because they needed it, and they weren't in shape. So, and my guys do that. You know, I'll be like, hey, they'll be like, hey, we need to go help them, and we do that. So that happens on a regular basis. So yeah, we want to take care of you completely if we can. We're not just.
Okay.
Any questions? Yes.
One more question.
On average, like if you are able to go, all, like what is there an average cost that is usually, for?
So we have, so we don't bill by like, you know, oh, we use this Band-Aid or this. So there's a set flat rate. And when I took over, actually we had 1970s EMS rates. So I hate to tell you, but we just did a 70% rate increase. And 70%. So we are somewhere around, and I don't have them in front of me, but I think I might be able to pull them up. What I can do is I have no problem disclosing them. I think they're in a file. I might be able to get to them off my phone. I'll try and do that before I walk out of here, and I'll let you know what they are. But in average, let's say we're charging $45 a mile. So I don't know, what do you get? 15 miles, 18 miles to a hospital, 20 miles max. So $45 a mile, and then somewhere around probably about a $3,100 charge for a paramedic, what they call an ALS-1 transfer. So we have actually started an IV and giving you at least one medication, something like that. It's lower if you just start an IV and no meds, that's something lower. And then if it's more meds, then they go to a higher rate. So, but it's all based on whether or not an IV was started, whether there's ALS care, whether there was a drug given, 2 drugs given, or 3 drugs given. If you're on a ventilator, if we put you on a vent, then that's even different. But again, right now, we are not billing at our what they call a specialty care transport, even if you're on the vent, because Wyoming regulations don't allow us to bill. So that is not a billable rate. That rate, it was $55,1630, so $5,516.30, and I think we just went to $9,380 for that. We're running Hamilton vents. I am about to get my 3rd. So every rig will have a Hamilton T1 transport vent. That is the top transport vent in the nation. It's what the air companies are using. And that vent costs $33,000. And I now am buying my 3rd. The Zoll heart monitor and everything that is $34,000 the way we have it set up. So $34,000 for that Zoll cardiac monitor that we can pace you. So if your heart's too slow, I can put 2 pads on there and overdrive your heart. It's kind of like a very large taser, except a lot more energy, and we do sedate you with that. But we can keep you alive by overdriving your heart when you have a pacer problem within your heart. It also defibrillates people. It also runs a 12 lead out of that thing. It also can be hooked up to, if we get an arc line in, we can transduce your internal pressure instead of running it off the blood pressure cuff. Because the weird thing about blood pressure cuffs is that when your pressure is real low or real high, they're terrible at beating that number. And that's really the important critical number. So a lot of times we get an outline and hook it up and transduce it using that device. So high level skills, ICU level type care.
You were saying earlier about the 911 calls, and where they can actually run you through medical procedures. I'm not really saying it correctly, but you're saying, so that is our 911 people here in Afton?
Yes, so they get trained in medical aid and dispatch.
Okay.
So they actually will they have a booklet that's put together and they flip to the page if it's cardiac, if it's respiratory, if it's a stroke. And they ask different questions, and then they are actually sending messages via I Am Responding, our app, directly to the crew that is responding to your emergency. So we're getting constant updates, and let alone we're talking about it. Yes.
How much land do you need in several range for that?
You know, I think ultimately, probably like a 5-acre parcel, because you know, you gotta get rigs in. We do have snow machine trailers that we would put up here, for response. We are looking at, so we have a response vehicle plus a rig, you know, an ambulance. So, and then potentially, eventually, I would like to move the EMS supervisor out of Afton, and I'd like to put their office here and be here. Because again, that EMS supervisor listens to every call, and they don't have to go to every call, but they better be at the important ones, or I'm going to want to rewind. So I tell my EMS supervisors, I don't know where you need to be every day when you're working for me, except when certain calls go out, then I know where you better be. So that's all. And so we would have potentially the supervisor and the crew running out of the thing, out of this middle valley station. That's what I like to call it.
Well, I think based on the population, it makes sense.
It does.
Because
It
Alpine is growing like crazy. Thane has got a subdivision coming up with 200 homes.
Yes.
And we still have over 900 vacant lots that could be built out here, so.
Yes. And
The growth will come.
I would tell you that I sit on, me and the fire chiefs sit on the planning and zoning meetings, which is pretty interesting. You know, we've got like 120 unit apartment complex that's being built right across the street from our clinic in Alpine.
Oh, Alpine?
You know, and at 120 unit apartment complex is St. John Health, and they're going to bus their people up the King.
Yeah.
So, I mean, and another 46 homes, another 48 homes, another, I mean, it's.
They have a hotel coming.
A hotel, huge hotel, yes.
Do you get the contracts that you already have to build up here in this year, or do you already?
I think the thing comes, I think what it comes down to is that, I mean, what are they gonna, I should.
Especially in a public meeting.
I guess, what is in the best interest of the community, right, is my concern. So, but like, if it makes sense, you know, then I think we just get with the town of Thane and Star Valley Ranch and say, look, you guys are in the Middle Valley, this unit serves you both, and what makes good financial sense, and then what makes sense for putting us, you know, close to high call volume, and that's what we've always done, you know. And so ultimately, whether it sits, you know, where it sits or it sits a mile or two this way, it's close to the both communities, and it's not a 30-minute response. You know, our goal is response to a 911 scene in the populated areas of the 13 communities that make up Star Valley within 10 minutes. So, and, you know, we have a couple long runs, you know. So, but I think it's always going to be a conversation about, in my mind, I would ask what makes sense. What is the best for the valley? What is the best for the community? And I think if we go at it from that aspect, I think that's probably the best. So, and again, those are 5-year contracts. And again, in one case, we end up with a little situation from the contract that put us in a quandary with regulatory things. So, you know, that's what happened.
Thank you. Very nice. Very interesting.
Well, thank you for your time, I appreciate it, and, we love serving you, and I, like I said, if you see my guys, they came to your public safety event, and they hopefully were interactive, and we, like I said, they like working in the same station, and they like working in the valley, so.
Thank you for sending Ms. Merritt,
Yes.
she's using the paper to this, big article about her.
Yeah, Sherry Merritt was with Fane EMS, and she is the one person, her and Courtney Barber, and then Shane Crook, have really stayed with us. And Sherry is just phenomenal. I can't say enough good about her. She can darn near work any position. You might find her in the ER, starting an IV, or you might see her at the admissions desk checking you in, or she might be handling your billing problem over in the administrative office. And she's got a work ethic like no other. And so she has been a phenomenal asset. And on top of that, her and Candace Jensen that live in Auburn run our PR committee. And so we're going to have a booth at the fair. We've got some pens and some lip balm and some sunscreen and some things and we're just trying to get the word out because I've had a lot of questions about, that people don't understand that we're all one.
Yeah, and that's true.
And so I had a person that called and said, hey, can you tell me about, we're having a Bible, a Bible school, and we want to have an ambulance come stand by for this Bible school. And I was like, okay, what kind of activities are you doing? Because I was like, you go motocross, right? Or monster trucks, or, the rodeo, bull fighting. And I was like, what kind of activities? She goes, well, I said, well, let me explain to you what's going on. And I told her a situation. She goes, oh, well, I guess maybe the most dangerous thing we would be doing is sack races. I said, I think you're going to be fine. Thank you all.
Thank you very much.
Thank you.
All right, we've got two motions to read. I go a little out of order here. So the first one is for the Planning and Zoning Board appointment of Tyler Gomez. Councilman Ellis.
You can find it.
On page 32. One more.
There we go.
There we go.
Okay. I move the town of Star Valley Ranch approve the mayor's appointment of Tyler Gomez to the Planning and Zoning Board as a regular member. This appointment is effective immediately and extends through June 30th, 2025.
Second?
I second.
And maybe a second, I don't know, Tyler's. Yes, all right, all in favor, say aye.
Aye.
Aye. Hearing none opposed, motion carries. Next one is for the Finance Advisory Board.
Okay, say that, Jay. Jason.
Oh, Jason's here.
I move the town of Star Valley Ranch approve the mayor's appointment of Jay Averett to the Finance Advisory Board. The appointment is effective immediately and extends through June 30th, 2025.
Second?
I second it.
Okay, it's been moved and seconded. Thank you for volunteering. It's really important. All in favor, say aye.
Aye.
Aye. Hearing none opposed, motion carries.
So,
You're on.
Jay was nice enough on the golf course. What can I do? It didn't take long to find the spot, so.
Yep.
I started working on my, because of my citizens.
Okay, we're moving on. All right, next thing on the agenda is the mayor's update. And, we can go through what's going on here, so you have a good idea of the master plan update. Our volunteer focus group, I think they've met and developed a mission and vision statement. And, based on the survey results, and the town council should hear that information soon, if we don't have anything about it. The WIP 2021, that's Water Improvement Project 2021. They're finishing up the services on the south end of town, and then when they're finished there, they'll move to the north end of town. There's some cul-de-sacs up there that they're going to do. The town will complete, maintenance layers on the chip seal, and that will be next week. And so, one of the other things we've done on the road is the council, has decided to continue to maintain the chip seal roads. And we've asked our engineering firm to, update our road and surface water study, that was done in 2013. So time to update, our traffic patterns have definitely changed. And so I'm assuming you'll have that to us by the spring, but we'll say so, since you're crazy busy right now. So, we're going to do that, and then that will really help the town council prioritize the roads, once that's updated, so we know exactly where we're at. Public Works they're working on Vista East still and Redwood, they have a big drainage project going on Redwood. They have to quit working on that for a little while, because next week is Firewise pickup, and it's also the chip seal project. And so they're trying to get everything picked up on those roads that we're going to chip. So they started working on this week. Next week they'll be doing that. Yes.
Oh, sorry.
That's okay.
I got a call today, the chip seals in the back.
You didn't tell Public Works, did you?
I didn't.
They might hurt you. Just saying. Okay.
Mayor?
Yep.
Just a question, the chip seal, will you be doing that on those roads you're gonna do the cul-de-sacs, you're gonna do the road work, will you be doing that after that work is done?
I'm not sure.
There's still some work that needs to be done on some cul-de-sacs.
Right, water, yes.
Yeah, so you're gonna do the chip seal after that for those roads?
No, this is for existing roads that are already done, so not.
Not dirt roads?
Mm-hmm.
There's
No.
no chip seal on any cul-de-sac?
No.
I need to get out more.
I was gonna say, it just doesn't work on a cul-de-sac, so that would have to be asphalt.
Dirt is all,
Yeah.
just dirt much for cul-de-sac?
That's
it?
For me. That's it. Where was I?
We needed some humor.
I know, I'm sorry. So Firewise will still be next week, even though the chip still has been moved for a couple of weeks, but that's good to know. The staff continues to grade and dust guard the roads. And when time permits, I've had a lot of questions about the town hall, because they came in and did a bunch of work, and then they've moved to roads, and that has basically weather. So when the weather's good, they're gonna be on roads, and they'll come back and finish this, in the fall when the weather's, not as good, so work on roads. Let's see, and then the other thing is, we've ordered a flagpole to be in front of our building, because you have to have a flagpole in front of the government building, and that should be here next month, so they're going to install it. So we want them flagpoles here, that'll have both the state and the federal flagpoles. Let's see, so that's everything that's going on here. You may have noticed across the street, we've taken off one of the lean-tos that was on the side of that building. They're pulling the building down. So structurally, the building is fine. We got that one off, and then as soon as the Trails crew does their big sale and everything, we'll take the other side out. So we want to make sure that that building doesn't pull down. So that's going on. We've had some issues with campaign signs being stolen, so just ask people not to steal them. I don't know what else to say. They're all pretty much all on town property. So.
You know, stomp on them.
Yeah, have a run over them, or anyway. And then, I've scheduled to meet in Canada tonight, September 14th, but we'll make sure we get that advertised, so we've got, some time. That's after the primary. The primary is August 16th. And then and that'll be in this building, up here, that's where you'll vote. The candidate tonight will be the 14th from 7 to 9 p.m. And then, the last thing is, a lot of people have questions about the fire contract. We have not signed it yet. It's right now at the attorney's office. And so hopefully we get that signed this week or the first part of next week. Anyway, we're still working on that. And that is all I have. I've got the update and all the things that are going on.
I'm so glad you mentioned campaign signs, because it's not just those people who are running for our town.
No, I know.
It's anybody, any candidate's running.
Yeah. And our ordinance allows them in the easement, so it's just.
So disrespectful. Doesn't matter if you like that person or not like that person or whatever.
They do. But because like I mentioned, earlier, I tend to lose a few, but usually I think they get run over, so. So, some of these I don't think are run over, but anyway.
Yeah, when somebody's actually stopped them down.
Yeah, I don't, anyway.
You put a camera out there or something?
There's a lot of cameras. All right, upcoming, activities. We've got Firewise pickup is next week, starts the 25th. The Star Valley Quilt Trail, that is July 29th through 30th. They're doing one of their stops in this building. So they'll be here, Thane, Etna, and Alpine. Evidently, Alpine didn't want to participate this time, so I was told. And so anyway, so it's just stay in our part of the valley, and that's cool. So, I know there's posters downstairs. We're trying to make sure that everybody has the information, but it's extremely interesting if you go. So that's the Quilt Trail. Lincoln County ED meeting, that's August 1st at 10 a.m. and that's in the county offices in Hampton. Our next town council workshop is August 4th and that's at 9 a.m. Coffee with the mayor is August 15th at 10 a.m. And the town council, workshop is August 17th at 9 a.m. and the regular meeting is August 17th at 6 p.m. And I believe that's it. So can I get a motion to adjourn?
I've been asked to ask about the bridge over Cedar Creek, if there's any update on that.
On Middle Branch Drive, there is not. We have to get permitting and stuff, so we're still waiting.
It's in the hands of our engineer. I mean, that's, his first step, I guess, was to contact the Corps of Engineers and obtain guidance. I'm not sure if you get any new input on feedback from the Corps or not.
Yeah.
Still waiting for some scheduling.
And I've heard,
So no time soon then.
no time soon.
Dealing with the Army Corps, good luck.
Yeah, I mean, we're going to do it right this time, so we're gonna make sure we get proper permitting in place before we do anything.
But I also want to reiterate, you promised that you would have a public meeting before proceeding.
Correct.
On that.
Yep.
Financial advisory board is concerned about the expenditure there.
$500,000 is how much that is. That is as of last month. It's probably going on. I don't know. But anyway, the council put $500,000 in the budget. All right, that's it. So can I get a motion to adjourn?
I move Council Leverage to adjourn this meeting.
Second?
Second.
Been moved and seconded. All in favor, say aye.